Collaboration between the health, education, and social sectors is essential for addressing the social determinants of health and to tackle health inequities and inequalities. We have a unique opportunity to come together to bridge the silos that separate us and tackle once and for all the health inequalities that scar the European region. We need to move beyond working in silos and towards strengthened joint action to make a real difference to people living in the European region and achieve our common goals and vision set out in the Sustainable Development Goals and also in Health 2020. By working together, the health, education, and social sectors can empower people and build resilient individuals and communities. This is particularly important for early childhood development, as we know that interventions at this stage of the life course brings the greatest return on investment. We have known for a long time that intersectoral action can contribute to improved health and well-being outcomes, but now we need to turn the evidence into concrete actions in order to meet the vision and ambitions of Health 2020 and the SDGs. The WHO is taking a leading role in convening the discussion by bringing together the health, education, and social sectors from member states from across the region, other UN agencies, other international organizations, international experts, and civil society. This marks an important first step in creating a continuous platform for dialogue and joint action, allowing us to work together to improve the health and the well-being of young and future generations in the European region. Health 2020 is the overarching policy framework and strategy for the WHO European region and provides the vehicle for achieving better health for all for a more equitable and sustainable Europe. Health 2020 emphasizes the importance of intersectoral action if health and well-being are to be improved and health inequalities tackled. The high-level conference in Paris in December is part of the process of Health 2020 implementation. The conference will facilitate the adoption of concrete actions and commitments between the health, education, and social sectors, as well as present the instruments and mechanisms necessary to support joint action. The earliest years of life set the tone for the whole of the lifespan. Acting on the root causes of poor health in childhood and adolescence can help to improve health across the life course, in addition to contributing towards the achievement of the goals and strategic objectives of the UN 2030 Agenda and Health 2020. We know that health is affected by the social and economic determinants of health, which go beyond the health sector. The health sector cannot address these alone. It needs to work with other sectors, and the education and social sectors are an excellent starting point, as we have many co-benefits and common objectives. If we fail to work together across sectors, we will fail our most vulnerable children and adolescents when they need us the most, and we will jeopardize their chance at a healthy future and meeting their full potential. Young people are at risk of being left behind and falling through the gaps unless the health, education, and social sectors work together to improve information sharing and service delivery. Well, what I would like to add is that the world will have to invest much more into the social protection, because if that is not the case, then these political developments that we see across the world and across in Europe will continue, and that will create even more tensions in the world than what it is now. And this is in the interest of the population at large, but this is in our interest also if we think in terms of the future of our children and grandchildren.